The bird flu outbreak in Ghana is raging, with more regions recording cases. At least 7 regions have been hit by the virus, with tens of thousands of birds either destroyed or dead. At the start of the outbreak, government rolled out containment measures, including a ban on the movement of birds and enhanced contact tracing. But that has not helped slow down the spread. We'll speak to officials of the veterinary services shortly. But first, here's a report from the Bono region on how officials are working to ensure birds there are safe.
Veterinary authorities in the Bono East region are instituting measures capable of preventing the outbreak of avian influenza, popularly known as bird flu, in the region. Regional Veterinary Officer Dr. Anthony Osetutu told Joy News that the department is monitoring the influx of birds into the region as well as the condition of birds within the various farms across the region.
To date, 5 regions in the country have recorded cases of outbreak of bird flu, namely Greater Accra region, Volta region, Central region, Western North and Ashanti region. Bono East region so far has not recorded avian influenza. I have tasked my district officers to be on the alert and look out for farms which are recording high mortality rates, so that they will send samples to us, and I will further send it to Accra Veterinary Laboratory for further testing to authenticate whether we have the outbreak of the virus, that is bird flu, in our region or not.
The department is also organizing sensitization workshops for farmers to educate them on various preventive measures to save their farms from the possible outbreak of the flu.
Plans are afoot to organize sensitization programs, education programs, to advise them on measures that they've got to put in place to prevent the virus, that is the bird flu virus, from affecting their birds. We have started at the official office level, and sooner than later we'll move to radio stations. We'll organize training workshop for them to ensure that they go by the biosecurity measures to ensure that bird flu is prevented from our region.
Dr. Antonio Osetutu, however, cautioned the public to consume only well-cooked chicken and chicken products to stay safe from infections.
I have to say emphatically that in this era, where we have outbreak of bird flu in other regions, which haven't got into my region, Bono East, yet, I'll say to all the public that they can consume chicken and chicken products, but except that they must be very well cooked before they consume them. We know that the virus, bird flu, the infection is of viral origin, and the virus dies at temperature between 60 and 70. And we know that well-cooked foods, chicken and chicken product, is at 100 degrees Celsius. So that if we adhere to such regulation that we must cook them very well at 100 degrees, the virus would have died, and therefore the product becomes suitable for consumption.
Reporting for Joy News, Anas Sabit, Tichiman.
We're joined by Dr. Benjamin Kisi Sasu, a veterinary doctor and a member of the Risk Communication and Social Mobilization Technical Committee at the Veterinary Service. Dr. Kisi Sasu, thank you for joining us. First, bring us up to speed with the cases since the last update.
Okay. Good evening to your viewers. I am so happy to July recording us, and we have entered to the 7th week. We have had the cases moving up to 46 cases. Lucky for us, from the last update that was given on the 16th to 29th, we have realized that from 22nd to 29th, we had only 3 new cases. For the 7 regions, most regions didn't record a new case. For us, looking at the data and looking at the situation is some kind of relief to us, hoping that if there will be other cases in the next few weeks to come, we are hoping it won't escalate for more, and we'll start seeing a decline. That's what we are hoping for. So for the first time, Greater Accra didn't record a case, Central region didn't, Volta region, as well as Western North recorded 1 case. We're hoping these regions will keep it at what the number that we have already seen. The problem we are having with new regions having these bird flu coming to their place. And that means that other regions which have not also gotten so far need to make sure they stick to the biosecurity at their farms. And to tell you, the few cases that have come in, we have seen big farms joining in. A farm with a population of 10,000, some with 5,000, some almost to 20,000 joining in, which means that no commercial farm should relax thinking is always having a system. Just a slight delay or a relax of the protocol or preventive measures could bring these bird flu to your farm. And they should not forget that the bird flu is also not only spread just by the human movement. They are wildlife or better to move and fly around. The original travel by these birds, as you could see, it was so shocking to have seen about 5 to 10 of the baby farms joining in. So this is quite a lesson to all farmers that they need to continue, not to relax. And this system we are asking for, a system that everyone needs to do it, not just because we currently have bird flu in the system. It was mentioned that they're supposed to do so to prevent any viral or any disease from entering their farms. It's also that some of the cases we are recording, the investigation team realized that still some farmers were visiting each other, especially in the case that we just had last week. There was a farmer who had it, and his other colleagues farmers went to console him, and someone
Veterinary authorities in the Bono East region are instituting measures capable of preventing the outbreak of avian influenza, popularly known as bird flu, in the region. Regional Veterinary Officer Dr. Antonio Seitutu told Joy News that the department is monitoring the influx of birds into the region as well as the condition of birds within the various farms across the region.
To date, 5 regions in the country have recorded cases of outbreak of bird flu, namely Greater Accra region, Volta region, Central region, Western North, and Ashanti region. Bono East region so far has not recorded avian influenza. I have tasked my district officers to be on the alert and look out for farms which are recording high mortality rates, so that they will send samples to us, and I will further send it to Accra Veterinary Laboratory.
Apologies for the break there. We had a little technical hitch, but let's go back to Zoom and speak to Dr. Kisi Sasu, who is with the risk communication team of the veterinary service. Doc, you introduced a number of measures, especially to prevent the movement of birds. Would you say that that has been adhered to by many of the farmers?
Okay, looking at movement of birds, normally it happens at 2 major stages. First, are they old when they are in their farm? So when they are due for market, that they move them from their farm. And so far, with monitoring the various live markets where they move to, we haven't recorded any case from. So we can't find out pinpoint that it is one of the cause. What we are currently seeing is farmers visiting each other, which we have asked them not to do. Especially some people visit affected farmers to find out in a locality. And also improper disposal of birds, dead birds by these farmers is also a major cause. When we get to the scene and before we depopulate, we ask them where are the other birds, and realize that wherever they place it, it wasn't properly done, wasn't well buried. Some were left just around, were not well done, and people end up somewhere even closer to where that people do pass, and the spread was easy. And when you get there, some of the farmers who come out and said it happened, they complained to their colleague, but their colleague did nothing to help this situation. So that's a big deal. Because some people are even burying or disposing these birds closer to where people pass.
And you did say that even though the update shows that you've had a few cases, I think you mentioned 47, some of the regions have not recorded new cases. Would you say that then the situation is under control?
Yes, once when the outbreak happens and we are within a certain period, we are not recording cases. It means that we are breaking a cycle, because every group we are getting a case, it might mean that that person or they have had a case. Those people working there, we have to find out those who they got in contact to. Once they got in contact to other people or in the vicinity, it means probably if the other people they got into contact to didn't follow the preventive measures, are likely also to pick the cases. So when we have a period where we are not recording new cases, then we are being sure that very soon we'll get to a place whereby the cases will be coming down and we can even have the outbreak ending. That's
So
what we
are you looking
hoping
in that
happen.
regard?
But all depends on.
In that regard, are you looking at introducing new measures to make sure that we do not go back on the gains that we have made?
All will depend on we are just waiting for 1 week to see. And hopefully next week, the regional veterinary officers together with the director will meet in Tamale to also look at the issue. So from there, they will come out with something they feel will help. If we feel they have to be more stiffer preventive measures, then we have to do so. For Malagana, we'll do so.
Thank you very much. That's Dr. Kisi Sasu. He is a member of the Risk Communication Committee of the Veterinary Services, joining us with an update of the outbreak of bird flu. So, yes, there have been new cases by way of update, but some of the regions, mainly in Accra, have not recorded new cases, and they are hoping that they'll be able to keep this under control.